may marireceive ka po na 3 links. These links are the mobile swabbing in Bahatin, health status log sheet, and occupants turnover, and also the house rules dito sa pagstay mo sa accommodation. Now, the mobile swabbing in Bahatin, these were done kapag dito ka magpapagawa ng swabbing. Pero kagaya ko, I already done the swabbing in the hospital in 15, Ward 15. Hindi ko na kailangan mag-fill up nito. Pero for those dati, nung nag-fill up ako nito, nung nag-high risk ako, ginawa yung swabbing ko dito sa Bahatin. That's why I need to fill this link. Pero dahil hindi na kailangan, no need for this one. So, daily health status log sheet. Ito po yung daily health check. Daily health check. So, you just have to fill that the day-to-day. Then, your name, age, then your MRN, your mobile number, temperature. So, febrile, ibig sabihin may lagnat ka. Febrile, ibig sabihin wala. So, nagkuha kami ng temperature kanina. Wala akong fever. Sore throat. I have an itchy throat, but not sore throat. Pero I will put yes on it. Cough, yes, I have a little. Runny nose, yes, I have a little. Shortness of breath or difficulty in breathing? No. Body malaise? No. Body malaise means body pain. Diarrhea, I don't have. Nausea and vomiting? No. Depression? No. Did the doctor call you? No. Quarantine day. So this is the first day. Then remarks. You will put what kind of risk you are. Low risk with symptoms. Bakit ako na low risk? Because I have a complete PPE, wearing a PPE, and I don't have any contact from any positive COVID patient. Also, just submit it, and your response have been recorded. Now let's go to another link. This is the occupants turnover. Occupants turnover is it's like the day of admission. So, ito yung day na dinala kami dito. So, date of admission will be today. Then you will put again your first name, your family name, your mobile number, medical file number. This is the MRN. Your badge number, ICAMA number, and your age. Date of first exposure is today. And so, 17. Date of exposure if you are exposed to a positive patient. Pero dahil hindi natin alamin kung sino ang na-expose or whatsoever, we will just put the first date today. So, yan yun. Then, first swabbing, I was swabbed today also. Department or unit, when you are working, I'm working in accommodation. I'm from Al-Nakil. I'm a Filipino. Category, low risk. Low, others. Ay, walang choice. Low. Symptomatic and asymptomatic. Symptomatic meaning you present any symptoms. Like for me, I have cough, sore throat, and runny nose. Pag asymptomatic, means absent. So asymptomatic, no symptoms. Pero dahil may symptoms tayo, we will choose symptomatic. Reason for quarantine: exposed to COVID-19, flu-like symptoms, travel history. So I will go with flu-like symptoms. Expected date of isolation. They told me it's 3 days. Pero, ang sabi, 1 day lang daw. Then, room assignment, I'm from level 4. Room number, you see, that's 29. And remarks, I will just put low risk with symptoms. Then, just submit. Okay, so we're done with the... Hi guys, so na-quarantine po tayo. So ito ang quarantine facility ng King South University, the Al-Bahatin Building 65. So I have here yung mga supplies namin, provided po on disposables and foods, enough for 5 days. Pero ako is 1 day lang. So I'm in Wing C. Then here's my room. I'm the only one po na magstay sa room na to dahil nga po sa social distancing. So here's it, 9:29. So ayan, it's an empty big room. Provided naman po, we have the sala. Ayan, may TV pa. Hindi ka naman manunood. At marami po ditong CR. Because this flat is for 6 person. Yung normal po. But during, dahil ginawa siyang quarantine, 3 lang po ang available po dito. Or pwede dito. 1 per room. Kasi may 3 rooms po dito. So, this is the kitchen. Ayan, so meron provided sila na microwave, ref, and oven. Pero syempre hindi ka naman magbe-bake. Cooking set. Then, yung kwarto, ito po yung laundry area. Meron silang automatic washing machine, drying rack. Then here is my room. O ha? Diba? Malaki siya. Malaki na. So this is KSUMC Staff Quarantine Facility. So provided po ang elevator 3 for transport and spacious area with syempre mga warnings and bulletin boards for updates. And no one is allowed to come here, lalo na kung hindi ka naman po for isolation and quarantine. So provided pa rin po mga trash bins. Yan. Dati nung na-quarantine ako dito, the swabbing is done outside the building. So malaki po yung yung parking area dyan sa labas kung saan ginagawa yung open space. So this is the housing office. So kung may mga concerns and the certificate of release, dito po namin kinukuha. So yan po, bawal akong lumabas. Hi guys! So, andito ngayon ako sa quarantine. So this is my first day sa quarantine ngayon. Hindi naman ito yung first day ko na na-quarantine. Hindi first time na na-quarantine, but this is the second time. Actually, yung first ko is high risk ako because I was directly exposed sa positive patient. Positive confirmed patient. Pero ngayon, wala akong exposure sa positive or direct contact sa positive, pero meron akong signs and symptoms. So, itatakal natin ngayon kung ano yung mga categories. It is the infection control who categorize them according to the statement na sinabi nila. So, regarding dun sa considering the meters, kung gaano kalayo ka sa COVID positive, how long or duration mo, if it takes minutes or hours na nagstay ka dun sa room with the positive, anong PPE na gamit mo? Are you fully wearing your PPE or you're just wearing nothing na PPE? Kunyari mask lang. And ano pa ba? Yun lang naalala ko sa ngayon. Pero yun, dun nila binabase. Kaya nga pinapakwento nila dun, ay ano yung description mo ng pagka-expose mo. Kasi dun nila ibabase ngayon kung anong kategori ka. So for high risk, usually ang nakikita ko dyan na kinakategorize nila is magka-flatmate kayo. Why? Kasi kahit naman magka-flatmate kayo, same commodes o yung CR ang ginagamit nyo. So kahit nasabi mong nakamas naman ako, pagpunta ako ng bahay, pagpasok ko ng bahay, sa kwarto ko na hinubad yung mask ko, still, you're using the kitchen, you're using the bathroom. So same. Kaya usually ang high risk namin is yung ayun nga, magkasama sa bahay. Tapos, yung medium risk, usually na nakita ko doon is naka-PPE naman sila. Although, there is one missing. Like, kunyari, naka-surgical mask sila. Tapos, nasa loob sila ng kwarto, nakipagkwentuhan sila for 30 minutes. Tapos, positive pala yung patient. So, yun ay consider medium risk. Kasi, syempre, yung time mo, tas medyo malapit ka, less than 1.5 meters ang lapit nyo kasi nagchichikahan kayo. Yun. Medium risk ka. So, yun yung mga category. So for low risk naman, syempre, naka-goggles ka, naka-mask ka, tapos naka-N95 ka pa. So, tapos nag-hand washing ka, although hindi ka naka-gloves, pero nag-hand washing ka every patient or every touch mo sa mga surroundings. So, there is a chance na low risk ka. So, it depends on the description and the details na iiwan mo or i-fill up mo dun sa link na binigay sa'yo na IC. That's why, wag basta-basta nag-fill up ng COVID exposure link. Seryosong bagay yun. Hindi kagaya. Ito naman yung case ko. So, ako ay laging naka-surgical mask sa work at saka paglalabas ako. Pero ngayon kasi, even the goggles. Pero, I was considered low risk, pero with symptoms. Nag-develop kasi ako ng symptoms yesterday. Flu-like symptoms. So, I have, hindi maganda yung boses natin. So, I have itchy throat. Then, I have running nose kahapon, pero ngayon medyo okay na siya. And then, headache. Pero ngayon yung headache ko, wala na, medyo wala na, lightheadedness na lang. Lumulutang ako ngayon, so lagi ako nakahiga. Then, so yun. So, I'm low risk dahil protected ako. I mean, dahil nag-wear ako ng PPE ko, but with symptoms. Usually, ang quarantine days ng low risk with symptoms is 3 days. Pero, sa case ko, dahil sabi ko sa doktor is halos lahat ng symptoms ko is konti na lang, sabi niya, mag-follow up ako tomorrow. So, I do the swabbing today. Katatapos lang ng swabbing namin, mga siguro 11:30. Now is 3 o'clock in the afternoon. So, ang resulta niyan is bukas ng, ang alam ko kasi bukas siya ng umaga, alas 9. Pero, sinabihan ako ng housing staff dito na be prepared at 7 o'clock. So, tomorrow morning, alam ko wala pa result ng ganun kaaga yan. But we will see. I have to prepare at 7 o'clock. So, as of now, ang ano ko is, kahit balot na balot ako, ang lamig ng pa ako. Although wala akong fever, pero feeling ko parang mainit ako. So, yun. So, as of now, wala pa akong iniinom na gamot. Kasi sa pharmacy, nung pumunta ako sa pharmacy, dahil flu season ngayon, wala nang supply ng mga gamot. Even vitamins. Ang available na lang na nakuha ko from cough syrup and for gargle and paracetamol and vitamin C, ang nakuha ko lang is paracetamol, which is hindi ko naman masyadong kailangan kasi wala naman akong body ache, pain, wala akong ganun. So I'll see you. Guys, so may message sa akin yung taga-infection control. Tapos ang sabi niya sa akin, Kin, you're positive. I said, Parang I'm just waiting for the word na joke lang. Pero as an infection control, bigla ko na-realize na sa tingin ko hindi niya gagawin yun to joke for the result. Siguro, guys, watch for another video of my life of a COVID person.